Good afternoon, and welcome to Privacy Security Spotlight, Network Security and Best Practices Regarding the Internet of Things in a Health System, a complimentary webinar from healthsystemcio.com sponsored by Proofpoint. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of healthsystemcio.com, and I will be your moderator today. We're going to encourage you to ask questions today. You can go ahead and type them in at any time in the Q&A box in the lower right-hand corner of your screen. Leave the default set to all panelists and go ahead and send them in. We'll be taking them later in the program, but again, you can send them in whenever they occur to you. You can download the deck using the URL on your screen, and I'll also send that URL out in the chat box. There's a shortened version on the bottom of each slide, so plenty of chances to get the deck. And we are recording today's event. You'll receive an email when our archive is ready, and a separate registration is required. Just so you see how we're going to spend our time today, we're going to go approximately 45 minutes. First, we're going to hear from our featured guest, Cletis Earle, VP and CIO at St. Luke's Cornwall Hospital. And then we're going to hear from our sponsor, represented by Joe Diamond, Director of Products with Proofpoint. And then we'll have our Q&A with Cletis. So without further delay, I'm going to turn it over to our featured speaker, Cletis Earle. Cletis, thanks for joining us today.
Well, thank you, Anthony, and I appreciate being here. It's a beautiful day here in Hudson Valley, and as you mentioned, again, my name is Cletis Earle. I'm the Vice President and Chief Information Officer at St. Luke's Cornwall Hospital. It's a two-hospital system in the beautiful Hudson Valley, New York. If you haven't been here, it's a special place. We house the Culinary Institute as well as our military academy, West Point. So it's a beautiful time, particularly in the fall. A couple of disclaimers. I just wanted to make sure that I speak on where we are as a health system. As a CIO, I'm very cautious a lot of times to say that you talk about security, because at any given time, you don't want to put a target on the back and say that, hey, this is where we are when it comes to security, and then you have a kid who has nothing else better to do than to try to thwart those efforts and make you on the front page of the paper. So for that sense, I do say we put a lot of things in place, but I won't kid ourselves. I don't want to kid ourselves to say that more work doesn't need to be done regarding where we stand with security as a whole. So we talk about, the name of the conference here, or this session webinar, is Network Security and Best Practices Regarding the Internet of Things in the Health System. And as we mature as a industry with healthcare, the Internet of Things has become more complicated. Although I will touch base on the Internet of Things, I will get more into the dynamics as far as security. But the Internet of Things, as it means to us, is moving forward with population management, population health, and being part of more dynamic information that's now available to us, or if not now, will be available to us as we moving away from a fee-for-service industry and to population management or a value-based solution. We're going to rely on things such as the Fitbit and on all these types of technologies, whether they're telehealth devices, and coming through to our health system, so that we can actually help manage the population outside of the four walls of the health system. We will actively, and we are here at St. Luke's Cornwall, we're actively integrating some of that data into our system. As we do that, we're finding ourselves becoming more susceptible to potential threats out there. And we can do a lot of these things, as I mentioned before, having access to data, connecting to the HIEs, but we are really putting information out there in the ether of the Internet, and we have to make sure that we're putting in methodologies in place that's going to help protect not only us but our patient information. As we know in previous vulnerabilities, such as what happened at Anthem, there's millions, hundreds of thousands of records that are available, and for the adults in the world, it's actually easier to try to put monitoring services in for those adults that are looking at their Social Security number after a particular breach, such as Anthem. But where are the biggest challenges are the children, because the children's data is now becoming available to hackers, and unfortunately, as a whole, we don't tend to monitor our children's information, and it can be years upon years that hackers are actually using this information for identity theft, and then being discovered at a latter part, which is can be a very painful piece. So that's where I consider the Internet of Things. We need to be proactive and put in these proactive efforts to protect. I have 4 children, and you better believe that I want to do everything possible to help protect their information. Another thing to talk about, let me move on to the next slide. Okay. Breach mitigation. I wanted to just touch base on what exactly is breach mitigation. From my perspective, breach, and it's elementary, but I apologize for putting it out there. But the definition is infrastructural violation as of a law, trust, faith, or promise. Mitigation, the act of lessening the force or intensity of something unpleasant. I look at breach mitigation as exactly as it's defined. We should think of ourselves to the next bullet that you may already have been breached and you don't know it. We look at the world as if we are breached. There's no way for us to determine emphatically that our organization is protected 100%. And because there are people out there that will obfuscate all of our efforts to be prepared. So whether it's our antivirus platforms or whatever solutions that we have in place, there are systems out there that are designed to go around those particular methodologies. As a matter of fact, in some of the systems that I have seen out there, we have several layers of AV. You can actually just check a box to say, okay, if that organization has this AV or that AV or these type of tools, here goes the methodology as a hacker to go around those. So in essence, it renders anything that we have useless. Now, many of the initiatives that we're talking about, we want to be able to thwart the efforts of the average hacker or person that's looking to do damage. But when it comes to initiatives such as state-driven, threats or cybersecurity efforts, or functioning hacker organizations such as Anonymous, there's not much we can do, and we're very aware that we can do but so much, in essence, in understanding what our attack vectors are and our attack vector thresholds. But there's but so much you can do, and the key here is being prepared. As I mentioned in the earlier bullet, if we're prepared, we realize that we're doing some efforts, and some of the things I'm going to talk about in the upcoming slides are going to help identify those efforts. I always like to look at our organization as an example. We're a medium-sized health system, but compared to some other hospitals that may be much bigger than ours or much smaller, we don't tend to have a significant amount of network and security experts that we can afford. Organizations like Chase, Target, Anthem, these organizations have hundreds of security people working for them, and unfortunately they will still continue to be hacked because, again, there's but so much you can do where people can go around. And one of the biggest gaps is, well, the things that I'm going to outline, you have your network vulnerability. You want to find out, you have to figure out to see how many attack vectors can your organization handle at one time. And you have to be able to ask the question of your team members, your ISP, what's the amount of packets that needs to be, flooded, that needs to flood your infrastructure. And to be honest with you, when I started to ask these questions with my team as well as partners, originally they didn't have the answer. And that's the key. We may not know what those answers are originally, but the key is working at those efforts to figuring out what it is and identify that particular hole, so that you can actually go about mitigating the risk, lessening the blow when it occurs. And, the other bullet here is hardware theft and loss. That is a major issue because no matter what we do in place, one of the biggest challenges is the human factor. We have a major issue when it comes to, as many tools you could put in place. Many organizations, end up losing a laptop, or lose a key fob or something of that nature. And one of our partners on the line, they have a white paper about, the human factor from Proofpoint. And these are the kinds of examples of scenarios that you cannot count on. You can put as much money and intelligent processes in place, but there may always be a factor or an element that you're going to be vulnerable to. Malware, encrypted bots. I'm not too sure how many people are familiar with the ongoing challenges associated with encrypted botnets. It is a huge problem because, again, an encrypted bot can actually lay dormant in your enterprise for an expeditious amount of time, and you would not be aware of that. And because they're encrypted, there's no way of actually being able to decipher exactly the intention of that particular bot. It is only until it wakes up and it's not in a dormant state anymore. But at that point, you can start to see some patterns. But again, it may be sitting dormant in your enterprise, and you may not know it. Another area, a threat and vector, mobile apps and devices. We talk about the Internet of Things, but we also have the mobility of things. And mobile devices is become a major challenge and pain point for organizations such as mine. As an example, we need to make sure we facilitate a mobile environment, whether it's something that we're pushing forward for our nurses and our doctors, or giving those clinical providers access to the medical record, whether it's internally or external in their offices. And it's been a challenge because we know if we don't put particular processes and policies in place, and not just having policies, but having some type of system that's monitoring that, people lose their phones all the time. And if there is not particular security measures on those devices, we have a big problem. Telehealth, medical devices or telehealth devices, as the population grows again outside of these four walls, how do we monitor the information, or how do we secure it? If I'm putting digital scales, O2 readers, or glucometers in patient homes, how do I make sure that there are point-to-point connections that are relatively secure and it's not necessarily making ourselves vulnerable? Again, this is something that now we're talking about extending our enterprise to patients' homes, and that's a big deal. And nonetheless, because even though we may work towards getting a medical-grade network in-house, I'm pretty much positive we won't have that same infrastructure at our patients' homes. I know people can say, well, you can have tunneling and, VPN tunneling or other types of point-to-point connectivities, but that doesn't ensure that by having a tunnel in place that, those areas or those locations are not propagated to security, threats. In essence, if you create a tunnel and that tunnel now has a point-to-point connection to your infrastructure, it's a high likelihood that that can actually propagate into your enterprise. It's a major challenge, particularly medical devices. Our manufacturers that we have to deal with our partners that is established already in our organization. This is a major problem that we've identified. Unfortunately, there's no true standard associated to security, and I do understand that, we have agencies, now starting to look at the standardization associated to medical devices, but right now it's still posing a huge threat to our organization. We know that, I'll give an example, Windows XP has been end of life for some time now, several months now, and some medical device manufacturers are still, in essence, supporting, XP as a platform where they sit on. It's a huge concern and that's something to, if we're talking about breach and mitigation, we have to keep that in consideration. And all of the other associated threats that I haven't outlined, you can go on for days to talk about threats. So I wanted to take it to the next bullet item and talk about breach notification or breach identification and associated timelines. Unfortunately, when I was just, I moved up from New York City. I was a CIO for a health system down there, and when I came here, within the first few months, we had a potential incident, and that incident put a lot of, let's just say, it was a wake-up call for me because, again, as a new CIO, you're pretty much given all of the infrastructure and layout of the lay of the land of the new enterprise that you're going to, and for the most part, everything looked pretty good and solid. And to my surprise, when we had a potential incident where it was a possibility that the chain of custody of having tapes was unfortunately not catered to as effectively as it needed to be. So we ended up losing some tapes, or one of our resources misplaced the tapes. And that unfortunately started a process. And it was a wake-up call, again, for me as far as this process, because although this discovery was 1 month, it took a amount of time to determine exactly what was the cause of the impact. It was a significant piece for us, but I have heard from other organizations that, for me, 1 month is a very small amount of time for discovery. For other organizations, it can even take up to a year to try to figure out what the problem was. And the due diligence, which was the remediation plan, or I should say the precursor to the remediation plan, and trying to figure out all of the dots, dotting your I's and crossing your T's, getting security organizations involved, doing assessments of your infrastructure. This took, for me and this organization, several months to try to do that due diligence and figuring out, okay, were we actually susceptible to loss? Because, again, even though we weren't sure, we had to, in essence, figure out and start the process, and you have to figure out if you're going to report it or not. And you have to do all of this due diligence. And again, right here, it's a 5-month timeline if you put the due diligence and the discovery, but it felt like it was, 2 years worth of work, because it's a considerable amount of effort in order to, figure out what that breach identification, piece was. And, we were able to come out on the positive end after all of these processes, as far as the potential breach. But what it boiled down to is that the remediation initiative now is ongoing. It is forever. I don't think we will ever recover from this particular potential breach, because we now know that we are completely vulnerable with certain aspects. So I'll go to the next slide and talk about the things that you needed to actually do, and again, having cyber insurance was one of the biggest factors of a health system. I've done these discussions throughout the country already when it comes to security, and I started to see a more and more knowledge to cyber insurance. This is one of the biggest steps to making sure we are protected and helping mitigate that risk, is creating these processes. And what you have here are the various steps of cyber insurance, identifying the limits anyone can claim, the main aggregate of the policy limits, sub-limits, crisis management, customer notification expenses, which is a huge aspect. As you can see, credit monitoring is the big one, and I believe if personally we have not been impacted by some form of insurance from the Chases or the Targets of the world, credit monitoring is a big beast. And we always have to provide that as part of the Office of Civil Rights, from their perspective once a breach has occurred. So these are some of the things that are covered in cyber insurance, privacy regulations, defense and penalties, forensic costs per claim, and what's the dollar amount, content injury, media wrongful acts. The content injury and media wrongful acts some of these things, as far as your brand, is another big factor when it comes to cyber insurance. You have to protect the brand and your customers, which are your patients. A lot of these cases, unfortunately, when a breach occurs, it's very difficult to get your name back, to say that you can reliably hold your data secure without people saying, well, let me go to another organization to have care. But the cyber insurance covers some of that, as well as a few other things. You can see data recovery, business interruption, cyber extortion, main policy deductibles. Apologies, I have cyber extortion twice. Data recovery and business interruption, crisis management, forensic expenses, breach response, gross premium, and additional premium to include business interruptions. But I want to go into cyber extortion as to give an example using that, and that's probably why I have it twice, because it's so important. I could tell you one of the recent challenges that we've been seeing is an uptick in security. And as an organization, we have mandated that we are not to participate in any cold call or any types of calls that somebody comes, a call comes from outside, from vendors that are asking for survey information. I'll give you 2 points of recent scenarios that came up. One was me directly. I had a company who called me up and said, hey, this is Cletis Earle, how are you? They so happened to get past my line of defense of people answering the phones, and they mentioned that, hey, you know what, I'm X from whatever company, and we have your information, and I want to make sure that everything is still current. And as soon as I said, I was kind of feeling them out to where they were, I got an email that came over from the person. And that person ended up saying, okay, you should have received the email. I want you to go ahead and click, to ensure that, this is the right person, this is the right email from that link. And obviously, all the bells and whistles went off on this one, that I was actually entertained by this effort, but I told them that, no thank you, I won't be participating in this, and I ended up deleting it. And also, basically turning that around and sending it on an email to the organization identifying this potential threat. But I just imagine how many people in the organization will actually click on that link and then potentially have, a catastrophic event occur. I can't guarantee that that was a malicious file or a malicious intent to the email, but again, this just shows how vulnerable we are to, these types of extortion-like attempts. I had another scenario where a colleague of mine, a vice president of revenue cycle, received an email from what it looked like our CFO, which is who she reported to, and the CFO in this email stated that they need to pay a vendor ASAP. And, again, what they did, what I thought was genius about this cyber attack or potential vulnerability was that they went past all levels of thresholds. So they discovered exactly what the accountability structure was in the organization. And they went to somebody who reports to the CFO and had the authority to actually pay a bill. And they asked that, they masked the email address of the CFO and asked that this be paid. And the problem was she luckily reached out to me and to our team, and we got our security people involved, and we saw that they were able to spoof the email, but they added an additional I. So it was very difficult to see in the email domain, but they added additional I. And ironically, after it was discovered and we were okay, before we blacklisted the email address, that individual or that group sent out another email saying, within a few minutes, saying, hey, did you take care of it, in a very authoritative way. So I found that as an interesting perspective on where we are with security and what's the next, level of what I consider extortion, from that perspective. So the lessons learned from our breach or our potential incident was, we figured out that we have to look at policy. Policy was the biggest piece in our efforts. So, looking at chain of custody, that's something that we didn't have. Data in motion, data in flight, however you like to call it. we realized that the organization was susceptible to having information, PHI, on tapes. And, we went back to our EMR vendor and, pretty much demanded a methodology on how we are to encrypt, information that are on tapes or things that are going from X to Z. So it was a challenge, but with a matter of time, once you're able to identify what the problems are, you're able to go back to your partner vendors and really encourage them to put things in place that's going to help mitigate that risk of exposure. Again, a lot of it has to do with policy, but a lot of it has to do with partner building, because there may be many times that those partner organizations, such as the EMR, may not even realize that this is a major soft point in the collection or cocktail of different initiatives we have in place. DLP, data loss prevention, by far has been the utmost successful campaign that we had regarding data loss. This is things going outside of our organization unintentionally. If your organization has not yet invested in the DLP product, I would highly encourage it. You will be highly surprised, as well as, I would imagine, discouraged to know how often data is leaving the organization. Excuse me. Endpoint encryption, talked about that as far as knowing if the data in flight, data in motion, also knowing that all devices throughout your organization are encrypted. I talked about cyber insurance already. The compliance of it, it's a major factor. Going back to DLP, we've partnered with our compliance officer in ensuring that this is not just an IT thing, because, again, it should not be. Security is a hospital or organization-wide initiative, and it's important that you get the stakeholders throughout the organization and you have this identified from even the board level and down to the executive team, and ensuring that there's compliance throughout. Constant revisions and the battle plan. As new technologies are introduced, you need to ensure that you're prepared, because at the end of the day, what you need to do is have an outlined plan and making sure that you test out that plan on an ongoing basis. So getting into the plan and talking about some of the dynamics associated with the plan, what we found that has been somewhat successful is, adopting a countermeasure strategy. The first part of the countermeasure, is removing assets, separation of duties, authenticate, authorize, and audit, layering, adaptive enhancements, orderly failure, policy and training, and simple, cheap, and easy. So going into the first part of removing the assets to the countermeasure strategy. Often removing an asset is frequently misunderstood, because some people believe removing an asset is once a vulnerability is outlined, you should remove that from the system. But that's not necessarily what we're referencing here when we're talking about removing the asset. Removing the asset from our perspective is making the target information, removing that from the equation. In essence, there are many times that Social Security numbers and PCI information or data is used throughout the organization when it doesn't necessarily need to be used. So that's something that would say can be easily removed. Again, remove if it's not truly needed as the operation of the business, have it removed. Many times, places in the organization, they use identifiers that doesn't need to be. Change that. Make sure you question and you challenge your partners to not include that information. Web portals, the easier the web portal, if you're starting to deal with the patient portals or anything of that nature, excuse me, ensure that this sensitive data can be limited. If it's a Social Security number, don't use it. If they don't capture it, it helps. In essence, we should always try to remove the lowest hanging fruit. Rethink how organizations classify identifiable indicators and challenge the rule, and I mentioned that a few seconds ago. Separation of duties. Many times, when something happens as a countermeasure, we have to make sure we coordinate our efforts or our duties as an organization. you should have separate teams. You should have a detection team. The team is responsible for detecting the problem and any new issues that arise, and you should have a reaction team, the team that is responsible for fixing the issues as they come up. And the reason why this is the case, hackers install code to distract IT teams. This may sound very nefarious or somewhat Mission Impossible-like, but it actually happens on a consistent basis. They put up different instances to distract your team. So if you can actually distract them, and if you can separate the duties and having a detection team just dedicated to identifying the threats opposed to the reaction team fixing them, you will help mitigate the risk that way. Excuse me. Authenticate, authorize, and audit. Authenticate, dual factor, creating a dual factor authentication methodology is extremely important. Various state regulations may help adoption of disruptive technologies. An example, in New York State, EPCS, Electronic Prescription of Controlled Substances, is something that's coming down the pike. It was delayed a year recently, but that solution required dual factor authentication, and all that means is something you know and something you don't know. If you can utilize and adapt that type of methodology in your organization, you'll end up being ahead of the curve. Authorized digital rights management can be a challenge, and enterprise-wide browser protected mode. As an example, you should ask your team, from your browser side, whether you use IE, Chrome, or Safari, whichever case, do you have the digital rights management in place and having that browser protected mode on as a default? I could tell you, I challenged my organization and we didn't across the board because that's very difficult to actually see. So we wanted to make sure we pushed out policies that ensure that all of the digital rights or protected mode was implemented across the board on all of our platforms. Hopefully you've mandated a common form internet browser so that you don't have various browsers to compete with in trying to manage that. Auditing, logging, authentication, and authorization transactions. This allows for effective incident response measures. So if you don't audit it and you don't have the auditing turned on local machines, it becomes extremely difficult to try to mitigate, to try to fix, and try to control. So again, you don't want to turn on logging after the event. You want to have it on before, so you can actually determine how long has how deep is the rabbit hole, they say. So that's a huge aspect of making sure and ensuring auditing is turned on. Layering. Add multiple countermeasures to increase the effort an attacker must take. It is imperative that you use a cocktail, again, I would use that term, of different types of methodologies in order to thwart the efforts of the attackers. You may have your different intrusion protection, your AVs. We at this organization, we have approximately 13 to 14 different types of solutions, whether they're hardware or software solutions that helps it. And again, it's the more technical barriers you set up, the more hoops they have to jump through, the hackers, and it will discourage various types of cyber threats. Again, for the common day attack, this would be an extremely beneficial way of discouraging that. Adaptive enhancements, similar to layering. This uses software to protect the facilities to compensate for deficiencies of other layers. And this is one of those things that's really software given that it makes up. You can turn it on, turn it off as you see fit. Orderly failure. Predefined incident response plan, as they talk about an attack plan. Measure the level of risk the organization is willing to take regarding outage and remediation plan. You'd be surprised to know how many, if you have a discussion with your clinical colleagues, that how many people are not used to actually having a system down, take into consideration the worst case scenarios, that the system may be down for a significant amount of time as you go ahead and try to remove the threats to the organization. it's an interesting task to have that discussion with your colleagues and your leadership team to see how adverse to risk they are, in keeping things down in need be. So if your EHR was breached, how long would you keep your EHR down before you go back to normal operation protocol? Policy and training. This is definitely self-explanatory, but unfortunately not taken serious enough. It's policy, policy, policy. Put in whatever you put in place. Make sure that you write it down and you educate folks on exactly what their intentions are to the organization regarding security threats. The organization should have constant training associated to security. IT employees pose the highest risk. I know many of you already know this, of the vulnerability due to the roles in the access control. So training associated to the IT organizations department is key and pivotal. Keeping the organization in the know regarding the latest attacks and phishing scams helps reduce the organization's and equipment. Think about it. I talked about the patient portal, or I should say the patient medical devices. We also give our employees access to via external means, Citrix or whatever, dialing in or through a VPN. But once we open that VPN up to our employees, they also expose us, so it puts a threat to us from that perspective. So mandating that, if an employee is required to connect to the organization, that they too follow the same policies at their home, as well as they're doing their home devices, as well as they're doing in the organization itself. Simple, cheap, and easy. I kept it. Keep it simple, silly. That's not the term we're familiar with, so I figured I'd be a PC here. But again, it does not need to be complicated. No need to overcomplicate security measures. Attackers, again, go for the easiest or the easier targets, the low-hanging fruits. So the more things you put in place, the more likely you are to thwart the general efforts. Using appropriate countermeasures, most threats will be addressed. And consider yourself already breached. I would love to end it the way I started. You're probably already hacked. Once you've identified that, you become more effective in addressing the issues as they come. So with that said, that's all for me. Anthony, I'll throw it back to you.
Thank you so much, Cletis. Great presentation, and we're looking forward to doing the Q&A in a few minutes. Now it's time to hear from our sponsor, represented by Joe Diamond, Director of Products with Proofpoint. So, Joe, thanks for joining us, and thank you and Proofpoint for sponsoring our event today.
Yeah, absolutely. It's our pleasure. Thank you for the briefing that you gave there, Cletis. That was fantastic information. I just want to really layer on top of that some critical things that you can do and very tangible strategies and tactics that you can leverage to ensure that you're doing as much as you can to prevent compromise and mitigate the damage of a breach. Like Cletis said, most organizations have already been compromised and they have no idea that they have been, right? So let's just go ahead and go through this and look at this more tactically, right? So ultimately, what are the sources of a breach? What are our threat vectors, right? So we really break this down into three key areas. So you have your attacks, and then you have internal folks. You have the folks who are looking to commit some sort of sabotage, and then you have the employees or folks who have entitled access to data that may be inadvertently leaking very sensitive data. For example, someone sending a sensitive spreadsheet with a bunch of health record information to their personal Gmail account. I don't know why they would do that, but we all know that happens all the time, and they should obviously not be doing that, and that's certainly a source of breach. But just by definition, let's go through this. So on the attack side, this is what I'm generally referring to here is really just about elaborate phishing campaigns and targeted attacks. The statistics show that 80% plus of breaches actually start with an elaborate phishing campaign. So let's look at this from the perspective of what can you do, if you were to take a minimalist approach to stop the biggest source of issues. If you were to just focus on one thing, if you were to focus on the targeted attack aspect of this and leverage a system that's actually going to leverage sandboxing, dynamic, and static analysis to ensure that sophisticated attacks aren't getting through your email gateway, that's going to be a fantastic start at ensuring that you aren't compromised. So the two other aspects are obviously protecting against the the insiders. So on the sabotage side, you have disgruntled employees and partners and contractors, and they're ultimately looking to exfiltrate sensitive data. This is obviously an outbound source of breach. And then you have, again, the mistakes. And these ultimately are all the various vectors in the most simplified form of where your breaches are being sourced from. So it's very important to be mindful and focus on these three key areas, especially from an 80-20 rule perspective, right? But at the end of the day, we're all resource constrained. We're all dealing with resource challenges. Your leadership is asking you to fix everything. They want you to protect against a breach and harden it against loss. They want you, at the same time, they're expecting you with minimal resources to ensure that you're prepared for e-discovery requests and supporting, electronic medical record implementations, providing breach root cause analyses, probably dealing with some sort of Office 365 migration, et cetera. How can you realistically be expected to deal with all of these things while at the same time protecting against breach, mitigating against breach, or the damage done in the event of a breach? It's a very difficult proposition for IT and security organizations to get their arms around. And in general, based on what I've seen from all the organizations that I have with health systems and healthcare organizations, you're not really seeing an increase in your budget, and you're not getting additional heads to actually support new technology, even if you do have budget. So it's a very difficult set of circumstances. So that's why I always suggest to folks that they be very, very mindful of the 80-20 rule here. And by that, really, what I'm trying to stress is that you focus on the 20% that is going to yield the most benefit for your organization. So be mindful of this. Look at this realistically. You heard Cletis talk about KISS as keep it simple, silly. I changed that silly to keep it simple, stupid, just to be slightly more abrasive, right? So embrace that and really be mindful of it. This is a mountain that a resource-strapped IT and InfoSec group can actually scale, especially if you're mindful of this as a policy. So just keep a laser-focused approach, eliminate the scattershot, and stop trying to do everything. Because if you do that, doing so guarantees that you're going to do nothing well. And if you do buy something, it's probably going to end up being shelfware because what you ended up buying ended up being way too complicated for you to actually deploy and maintain. So just as a simple scenario, if you're an IT and InfoSec team of 5 and you're supporting a mid-sized healthcare system, you have no budget and you have no new heads, again, weigh the impact versus the effort. If you try to embrace some sort of complex data classification paradigm or a data loss prevention system, for example, that is oftentimes way too complicated for a small IT organization to absorb. You're having to, design policies, design enforcement and remediation capabilities, et cetera, consistently tune those policies. There's a lot of work involved there. That's not to say that it's not a good approach. That's just to say that you need to be mindful of what that's actually going to entail. And then one of the last options that you can take is an automated sensitive data discovery and remediation capability. And the automated aspect of this is key. No one has, or most organizations don't have the dedicated resources in place to manage a DLP solution, a traditional legacy DLP solution in an ongoing basis. It generally takes full-time equivalent employees just to manage that system. So be mindful of that. Be realistic, keep it simple, and embrace that 80-20 rule, and you'll have a lot more success. So again, let's break this down. If you're to do 2 things, if you're to leave this webinar and do 2 things, what can you do to yield the most benefit, the most bang for your buck? Focused on targeted attacks and emerging threats. How are those coming in? They're coming in through email. So, again, 80% plus of data breaches are actually sourced initially from a elaborate targeted attack. And obviously, these types of attacks are massively on the uptick. Be mindful of that. What should your requirements be for that type of solution? As emails are coming into the organization, you need all the URLs that are coming in to be rewritten. And why is that important? So you can actually track who's clicking what, and also determine through dynamic analysis and sandboxing for all those incoming URLs and attachments whether or not that actual individual user and that machine has been compromised. That gives you a who clicked what type of visibility to ensure that you're actually able to rapidly respond to a threat and rectify the issue on that individual machine before it becomes, an all-out breach. Leverage that one thing, and you've already paid dividends here. The second thing, at the end of the day, when someone is attempting to breach your organization, what are they ultimately looking for? They want data. They want specifically sensitive data that they're able to append a dollar value to, right? So the way that you can rectify that is embrace a strategy that's mindful of, okay, my data is valuable. How can I, at the very least, understand my attack surface, where the sensitive data sits, and who has access to it? And bottom line, how can I do this in an automated fashion that's actually going to scale for my organization? So focus on data at rest, right? Focus on what bad actors are ultimately after, and that's the data, right? So what are your requirements for this? You need to have automated visibility into the size of your attack surface. You need to have automated remediation for the sensitive data in unsecure locations. And and very simply, it has to be easy for you to deploy and manage. It has to provide you with templated-based policies, and it has to have a limited footprint. By that I mean you don't want some old school draconian type of system that's going to sit on premise and require 20 to 30 servers just for you to implement, depending on the size of your organization implementation. Make sure that it's going to scale and work for you. Lastly, I want to leave you guys with a couple of resources that I think will be extremely helpful for you to basically build an understanding of the size of your attack surface and also build a business justification internally within your organization to help you potentially get budget if you don't have budget to solve those two key problems. So at Prepoint, we do have something called our data profiler tool, and this is a completely free tool. It's just a simple executable that you can run on any machine. It can be an endpoint, it can be an actual member server. It doesn't matter. You run that executable, you point it at a file server or a specific set of UNC paths, and it's going to run automatically and provide you with a full report of the sensitive data that it's discovering across that specific set of locations. So what that gives you visibility into is this problem an epidemic or not? Frankly, it more than likely is. Very few organizations have legitimate visibility into where the sensitive data sits, but you can get this visibility with this tool. So many organizations take advantage of this just to understand the size of this attack surface. And the second thing that I'll point to your attention is a report that we recently put together called the Human Factor. And the Human Factor is really a study that we put together that's really all about the analysis of understanding the end user behavior and what it is that they click, what it is that they click and why it is that they ultimately click on malicious links. You're going to be better equipped to actually handle breach, malicious insiders, outsiders, et cetera, if you understand your end user behaviors. At the end of the day, social engineering is a huge aspect of this. If you protect your data by understanding the size of your attack surface, you understand how your employees click and what they click, and you're stopping advanced threats from actually penetrating your perimeter, then you're going to be in a much better shape to actually ensure that you're preventing sensitive information from leaving your organization. And with that, I'll pass it back to Anthony.
Well, Joe, that was a lot of good information. Appreciate that, following on Cletis's presentation. So we're running a little long today, but I just want to give people the opportunity. I'll ask a question or two, and if you've got any questions, go ahead and send them in now, and we'll get those in front of Cletis. First question, Cletis, is what type of policy do you have for employees who click on malicious links? And what if they do it more than once? Have you ever had that situation where somebody made that kind of mistake more than once?
Well, there's a couple of factors. So malicious links, those that are known, we use our filters, and again, you have your next-gen filters that are out there so that the system can actually help determine if it's a known, malicious link. But we've been relatively lucky, per se, that, when folks are clicking links and if it's been a problem, it's been reduced. So I don't have any examples that you see on the commercials where it propagates throughout the organization that takes it down. I don't have any examples, and I like to chalk that up as because we have so many layers that we've put that in place. But the policy does mandate that, only certain users have the accessibility to go out to the internet as we know it. Others, if it's not a trusted link, our web filters would not allow it. So for those others that actually do it, they will actually be held accountable leading up to, but not necessarily to termination. So those are the things, those are the ways that we've gone about handling that. And don't get me wrong, it's a problem because, many people say, hey, this is hurting the way we do business, but we take those on a case-by-case basis.
Very good. Question from the audience. Do you see attackers hacking into fiber to steal information?
You said that's to the audience or to me?
That's to you from the audience. Does that question make sense to you?
Yeah, it's hacking into fiber.
Yes.
If it happened, that, great question. I just don't know if it's happening, because if somebody's hacking into fiber and they're hacking into fiber out there at the DMARC out there, right, I would never know because that, circumvents everything that we've done, so it's a possibility, but I think those are, that's a great question, and I can get back to the group by, reaching out to the ISPs and seeing, hey, are you seeing any malicious information that way? That's an excellent question.
Well, maybe I know you're going to be working with us again on security webinars, so maybe that's something for a future event to look at.
Yeah, absolutely.
All right, well, we're about out of time today. We've even gone a little long. And so I want to thank Cletis very much, and he's going to be doing these with us quarterly, touching on different aspects of security. I want to thank Joe and Proofpoint. And Joe, thank you for your excellent presentation, very much in the tone of education, and I think also very valuable for our audience. As I mentioned, you'll receive an email when our archive is ready. Should be within 2 business days, if not sooner. For those of you who are CHIME members and hold the CIO certification, attending our webinars gets you 1 CEU for each event. If you've asked us to let CHIME know of your attendance, we will. If not, make sure you let them know yourself. Questions, comments, you can always reach out to me, and you can go to our website to see our past 12 months of archives, and we've got quite a robust upcoming schedule. So again, I want to thank Cletis and Joe and Proofpoint, and everybody have a wonderful day.
Thank you very much. Take care.
Thanks, everyone.
Take care.